Thank you, everybody, for your time today. We're going to talk a little bit about being an egg donor and just educating you about the process and answer any questions you may have about it. Okay, so we'll get started here. So what is egg donation? Egg donation is when a female provides eggs that have been manipulated outside of the human body with the intent of producing a pregnancy in a recipient. And what is a recipient? Recipient are the intended parents or a gestational carrier. This female cannot be a sexually intimate partner of the intended parent. This keeps things very separate. This female will also not be obligated to any parental rights or responsibilities for any resulting children from the process of egg donation. Who needs donor IVF? So donor egg IVF involves patients who sometimes have medical indications for needing donor egg or have a history of infertility, unsuccessful infertility treatment. So starting with our list, we have postmenopausal women. Postmenopausal women can still obviously conceive and have a baby. The uterus still works after menopause. We just have to supplement with hormones. The biggest challenge is not having eggs available. So women who are postmenopausal, which can happen in your mid 40s, early 50s, can actually use donor egg. Our age limit for donor egg with our practice is 55 years old to be able to use donor egg. So postmenopausal women. Premature ovarian insufficiency. These are women who actually go through menopause at an earlier age than expected. There can be genetic reasons this happens. There can be medical or environmental exposures that can make this happen. But basically, they're going through menopause less than age 40. So we call it premature ovarian insufficiency. So these women may need donor egg as well. Diminished ovarian reserve is also a reason for needing donor egg. So these are women who are not quite menopausal, but they're still dealing with the challenges of having a lower egg count. They may be in their early 40s, mid 40s, and they're noticing that their ovarian reserve, despite doing treatment, is not leading to healthy embryos for embryo transfer. The challenges of being older involve not only a lower egg count, but also lower quality eggs. So going through IVF, sometimes these women, they may retrieve eggs, but they may not end up with a healthy embryo at the end of the day. So with the diminished ovarian reserve, they may consider donor egg as well. Genetic indications for donor egg. So there may be some people who carry genetic mutations that are inherited that they don't want to pass down to their children. So they're worried about things that can lead to some disability or developmental delay to their children, or even lethal aspects that they are worried about. So genetic indications, there are going to be some patients who have mutations that they're worried that may not affect them personally, but could affect their child in a more severe way, or can get progressively worse the next generation. Those are reasons that patients may consider donor egg for genetic reasons. We also have patients with poor egg and embryo quality. So they've gone through IVF cycles, despite their age or the number of eggs that they get. For some reason, they're still getting poor outcomes. We don't have a reason why. We just know there's a quality issue that may not be a reflection of their age or even medical history. Sometimes after doing multiple IVF cycles and not having success, the doctor will present them the option of switching it up and considering donor egg or even considering donor sperm. But this is an opportunity for a couple to maybe change their outcomes after having repeated failures. And that goes along with my next point of the failed attempts to conceive with prior treatment. And then the last reason is men who don't have a cisgender female partner or those who have a trans female partner. So they are planning to use a gestational carrier. And with gestational carriers in this situation, we don't want them to be the egg source. So these men will also consider using a donor egg, and then they'll search for their gestational carrier as a separate female involved in their process to have their family. So who can become an egg donor? So we do want compassionate women who want to help other women conceive. I think being an egg donor is such an amazing opportunity to help other women. We talk to women about egg freezing and the opportunity to freeze their eggs. Unfortunately, it did not become more accepted, meaning in our field, we didn't consider it non-experimental until 2013. So you think about the number of women who may have been a good age to freeze eggs before that time, who may not have gotten the opportunity and are presenting at a later age where they didn't have the opportunity for egg freezing, and now donor egg is their only option. So someone who's able to proceed with egg donation is really helping those women who didn't have that opportunity to freeze eggs or preserve their fertility or pursue getting pregnant at an earlier time in their lives. So we want a woman in good health. We ideally want between ages 20 and 29 they can volunteer to donate eggs. In our donor egg program at HFI, we will let you stay in the program until about age 30. The reason we limit the age to 30 is because there's less risk of genetic abnormalities in this age group, which is what a lot of women who are postmenopausal or have diminished ovarian reserve or poor oocyte quality or poor outcomes, they're looking for those improved rates by using women less than age 30. We also don't want patients who are at high risk for HIV contraction or have a history of sexually transmitted diseases in the last 12 months. Egg donors, we want you to be responsible, dependable, and committed to the process. It is a dedicated amount of time that we need from you. You know, we put out a calendar for you, give you an idea of when the retrieval will come. But during that monitoring process, it's crucial to make those appointments, to make sure we're monitoring you safely. It's not only to get the outcome of having a good number of eggs, but also for your health. We want to make sure that you're responding appropriately and that we're taking care to make sure you get through this safely. So what are the requirements? So there are a few things that an egg donor has to go through. We go through medical and psychological screening tests. There's an online application that involves you providing pictures, because obviously these women and men are looking for some characteristics of their donor that will help reflect the things that they're looking for in their family or reflect something in their own family that they want to see. We will do some medical record review. We'll review family history and screen for any family medical problems, family genetic diseases that could affect the outcome of a future pregnancy. So all of that gets screened ahead of time. Once the screening is done, you'll come in for baseline testing. And baseline testing is basically coming to our office to start the blood test and ultrasound. And when we say baseline, the timing is usually at the beginning of your menstrual cycle. So you'll call the first day of your period. We try to bring you in the second or third day of your cycle to get an ultrasound and blood test. And that gives us an idea of your ovarian reserve, making sure there are no physical abnormalities of the uterus and the tubes or ovaries that could affect the egg retrieval process for egg donation. We do genetic testing. So despite just hearing your family history about anything genetic, we also do genetic carrier screening to see if you carry a genetic disease that doesn't necessarily affect you, but may be something that you're carrying that could be passed on to the child. And if the intended father, also has that same disease, as he's also a carrier for that disease, there's a risk, that 25% risk sometimes, that the child may have the disease. So we screen to make sure that the donor is not a carrier. It doesn't rule you out completely, but by knowing that you're a carrier, we'll make sure we're preparing to check the other parents and making sure that they're aware that you're a carrier, and if they want to also test the intended father for that same disease. Now, we do a matching process where we match our donors with recipients. Obviously, they're going to be recipients looking for a certain characteristic in their donor. They're going to be taking the time to do the selection process. And once you're selected, you'll kind of move to the next steps. Psychological interview is important. Egg donation is, such a wonderful opportunity to help other women, but we want to make sure that donors are comfortable with their decision and the potential outcomes of having children out there that are genetically related to you and what that means for you personally, and making sure you're comfortable with that outcome. We also teach you how to take your injections. These are self-administered. They're not difficult to administer. If you know anyone who's a diabetic who takes insulin, it's the same needle that they would use to give themselves insulin that you give to yourself as far as the injections. The injection portion is usually a 2-week process, and we'll talk more about that in a minute. We also do a physical exam just to physically check you head to toe, make sure there are no recent tattoos or piercings that we need to keep in mind, because we're always thinking about risk of infectious disease like hepatitis C. We checking for any prior surgeries, and if those surgeries or scar tissue would make it difficult to do the procedure. checking blood pressure, your vital signs, just to make sure that these hormones aren't anything that's going to affect you or be detrimental to your health. And then we end with the consent forms, and that's just getting your consent to doing the procedure and the egg donation process, and making sure you're comfortable with the potential outcomes of going through the procedure. Now, how does it work? We usually start with about 2 to 3 weeks of the birth control pill. The birth control pill is helpful for not only timing, but it helps synchronize the growth of the follicles for the egg donation. By taking the birth control pill, it basically will give us a crop of eggs to grow at the same rate. That gives us a more chance for having more mature eggs, which is our goal. More mature eggs are the eggs that we can actually fertilize with sperm. After 2 to 3 weeks of the birth control pill, you'll start the injections, and the injection process for most women is about 8 to 12 days. That helps stimulate more eggs to mature than would happen normally in your menstrual cycle. Now, at the beginning of your period, when you start bleeding that first day, your body brings a bunch of eggs to the starting line. So each ovary has a crop of eggs that one could be potentially selected to ovulate that month. Your brain is only going to pick one with the use of the hormones FSH and LH. So your brain picks one of those eggs, and the rest from that crop get lost. So when we're doing egg freezing or egg donation at the beginning of your period or after taking the birth control pill, we give you hormones in a bigger dose than what your brain would do to get them all to grow. So that's what we're doing, recruiting what the eggs that you would have lost every month for the one. That's how egg donation works, IVF works, egg freezing works. So this is the same thing. During the 8 to 10, 12 days, you're going to be monitored pretty closely. So be prepared for 5 to 6 visits, because we are seeing you every other day, watching the follicles grow. They start off at about 1 centimeter and double in size around the time of maturity. So we're watching that growth. We don't want to miss the opportunity that we go too late or go too early for the retrieval. The timing of the egg retrieval is what's going to give you the high chance for having more mature eggs. Once it's determined that your eggs are mature, we'll perform the egg retrieval process. And that is done under anesthesia. It's an outpatient procedure. It takes 20 minutes. There's no cutting on your tummy, no big incisions. Everything is aspirated through the vagina. Your ovaries actually sit very close to the vagina. So it's such an easy aspiration. Patients wake up after 20 minutes, they feel like nothing's been done. But most people may complain about things like cramping, like your menstrual cycle, but nothing more than that. So what are the risks? So the big thing is that when you have your normal menstrual cycle, you may notice you get bloated at certain times of your period, but with the egg donation process, obviously you're getting more eggs, so you may have that same bloating a little bit more. It's only temporary. Usually when patients have their period a week or 2 later, a lot of that bloating has dissipated. Patients will notice hot flashes because of the hormones that are being suppressed at the beginning. They may notice they feel hot flashes. They may feel like they get more headaches, and they may feel that they have trouble sleeping. And all of this, like I said, is temporary. We do have more serious but significantly less common risks that happen. One of them is called ovarian hyperstimulation syndrome, and this occurs in less than 5% of cycles. So this happens when a woman has a lot of eggs. So sometimes with a large number of eggs, there's more bloating, there's more fullness. And with that fluid, that bloating sensation, the fluid that's usually in your blood vessels can leak out and cause that discomfort from the bloating. There may be more risk for blood clotting. Patients may have electrolyte abnormalities, meaning we encourage them to drink a lot of water with electrolytes. But eventually it does subside. We have a lot of medications to prevent this from happening. When I was a fellow at Columbia, I feel like we always had admissions for hyperstimulation for egg donors. And it's because now we have different medications available to help prevent that from happening. We have different types of triggers and medicines to help mitigate those symptoms. So I'm gonna knock on wood, but it's like we get an admission for hyperstimulation maybe once a year, if that. So it's very, very minimal, very low chance of that risk. Ovarian torsion is when sometimes the ovary can twist on its vascular supply, so on its vessels, and that cuts the blood supply to the ovary. That's very rare, and it's less than 1% of all cycles. Patients who have that happen, sometimes there may be some other mitigating circumstances that cause that, like some anatomy situations about the ovaries that can happen, but it's not a very common thing that we see, ovarian torsion. Bleeding is just bleeding from the procedure. We're using a very tiny needle to aspirate the follicles that have the eggs. We're not transversing any vessels, but obviously there can be a little bit bleeding for patients, but the risk of heavy bleeding or hemorrhage is less than 0.5%. And then infection, just like with any procedure, there's always a risk of infection. It's less than 0.5% as well, so also low risk. And then the last thing I bring up is pregnancy. Now we're getting all of these eggs and retrieving them. We are encouraging patients not to have intercourse during the time of the process and the month after, because despite us going after every follicle to retrieve an egg for every follicle, there's still a chance there could be an egg or two left behind, and that risk of a pregnancy or multiples can happen. So we will talk to our patients about protected intercourse. Really should be avoiding intercourse because we are worried about infection being introduced in the vagina after having the procedure. So we highly encourage being careful. Obviously, conception is still a possibility at the time of egg donation. And then the steps that you can take to safely donate successfully: avoiding sexual intercourse, which I just discussed, avoiding tobacco use or exposure. Tobacco is really bad for egg quality. You know, there are studies that show that just for women in general, if smokers tend to have a lower egg count compared to women who are non-smokers. So definitely avoiding tobacco and exposures during the process. Recreational drug use definitely is going to be recommended to be avoided completely. Avoiding alcohol, just like I said, to a minimum. I would tell patients avoiding daily alcohol use. Any patient who's trying to have a baby, we'll talk to them about limiting alcohol intake. And then talk to the egg donor coordinator about any prescription medications you're on not related to the treatment, and any over-the-counter medications you're taking, because we want to make sure there's nothing, because you'd be surprised, some over-the-counter medications can actually interfere with the egg ovulation process. So we do make sure that everything you're taking is safe for the process. We want you to abstain from any physical activity. And that's a great thing to keep in mind. I think with the egg donation process, the first couple of days, like halfway through, so remember it's about 12 days, 10 to 12 days average. The first 6 days, you may not feel much, but as you get past that 6 days, your ovaries are going to be a little bit bigger. Because if you think about it, a follicle gets to almost 2 centimeters in size, and we're trying to get as many of those as we can. So your ovary grows to a good size, maybe 7, 8 centimeters. And at that point, your ovaries are bigger, you feel more full. We don't want you doing a lot of physical activity because that's the risk of the ovary can twist and cause torsion. And it's uncomfortable. And you'll feel like you have a water balloon sitting in your tummy when you go through this process. So you may not even feel like doing vigorous activity at that point, but we really highly, we encourage you not to, if you want to go for a walk, something really easy, but really avoiding anything like CrossFit or running a marathon. And then the last thing, we want you to manage a balanced diet. So fruits, vegetables, stay hydrated, dairy products, as long as you don't have a severe allergy, of course, just a balanced diet. And taking a prenatal vitamin is a good idea, or a multivitamin during the process as well. So when it comes to the financial obligations and compensation, when egg donors are not expected to pay for the medical or psychological tests or any of the screening, medications, procedures leading up to, during, or after the cycle. All of that is covered by the practice taking care of you. Donors do receive financial compensation for their time, their energy, that they put into donating their eggs. So the donors do get compensated. There is a lot of, as you can see, dedicated commitment to the monitoring process and getting the retrieval. So there is a fee for donors who are proceeding with egg donation with our practice. And we'll move on to Brittany, who's going to talk a little bit about her experience.
Hey guys, thank y'all so much for having me. So I'm so excited to be on this call today. And one thing I always wanted to share was in asking for this opportunity is just how easy it is, I guess. A lot of people don't realize like, oh, you can be an egg donor, and well, it's not really that hard. And I don't mean to downplay it, but I just got a Facebook memory the other day, and I had donated my eggs for the first time about a year ago today. And I looked through my emails. I've done it 4 times in the last year. And all in that time, I've moved to a different state and done like a million different things, and it really didn't impact my day-to-day. So I really just want to share like my personal experience. So I was just at my regular like well woman, and at the time I was like, oh, I'm not gonna have kids, like that's not for me. And I thought, just like everyone else thinks, oh, if I donate my eggs, that's all that I was born with, so they're away. And I was really wrong with that. They were definitely not all gone. That's not how it works. So I had to be educated. But my gynecologist was like, hey, why don't you go upstairs to HFI and be an egg donor? And I was like, oh, great. I would love to donate my eggs. And I didn't know at the time you're donating your eggs, but you actually can make money. But I thought I was just like donating them. And so then when I go meet with HFI, they do all the tests, they do everything on me. I'm like, oh, you can get paid for this, even better. You know, I'm young, and at the time I had, I really wanted this. I'm going to be completely honest. This like blue Chanel bag, and I was like, well, I can get this. Which seems a little crazy, but I was like, oh, what's 2 weeks of my time for this? So I was really grateful. Everyone was so, so nice. And so it was a really good experience. Now, I said I've donated 4 times over the last year. And one thing I want to talk about is my experience leading up to being an egg donor. So she mentioned all those tests. And guys, I want to be the first person to tell you, don't be overwhelmed by that, because I was like, oh, I need to go get this ultrasound, and I need to get this blood work and a psych evaluation. And I was like, this is a lot of work, but it really wasn't. I only had to do all those pre-tests the one time, and correct me if I'm wrong. I don't know how it works, like after you've donated so many times or so long. But it was really enjoyable. One thing I will say that HFI does that is really awesome is they really treat their donors like family, y'all. Like the past year, the staff has become like my family. I'm really close with Mary Lou, the egg donor coordinator. She is the most amazing. Like she will probably get Christmas cards from my family every year. I think she had to hear me cry one day on the phone. And she's just the most amazing. So the staff is really close. And one thing they really do is they treat their donors like family. So if you're really honest and you tell them how she had mentioned those appointments, y'all, I told them like I have a full-time job. They would get me in like at right on time. So if you go to the front and you're like, I'm Brittany, I'm here to check in, they really value your time. You're never going to be, you know, things happen, but you're not going to be sitting in their waiting room for hours. Like that's not going to happen. They really value the donors. They get you in, they get you out. I mean, I was in and out. I mean, I know the Woodlands location has valet, which is great. I definitely use that a lot, but I was always in and out. I mean, they really treat their donors really well. And then y'all, the injections, I'm a baby. Like I sometimes want to cry putting fake eyelashes on myself because it's me bringing something at my eye. The injections, like she had mentioned, they are like an insulin needle. And if I can do that to myself, anyone could do it. The only needle I'm okay with is Botox, and that's because it takes away my wrinkles. So that was an experience for me, but also very manageable. Another question a lot of my friends have is like, oh, will I gain weight? Like I said, I've donated 4 times in the last year, and I've actually lost 40 pounds. And so it affected me 0. And I don't know why, but for some reason, like after my first donation, my skin got better. And so I was like, oh, this is great. And then one thing I do want to share is I have the Paragard. So it's an IUD that doesn't have hormones in it. And doctor, you are like, please chime in. But I was actually able to donate my last time, and I had it. And that was so shocking to me. I didn't have to get it taken out. And so I was really excited about that. And then my recovery after the process, I mean, this isn't recommended, but one time I went back to work. I mean, it was like they offer you like medicine. I'm like, I didn't even take Tylenol. It literally wasn't even as bad as my worst period growing up as a kid. Like I would get like sometimes like back cramps as a teenager. I'm like, oh, this is nothing. And so don't go back to work and don't drive. Don't be like me. But the only other thing for the recovery after is I always would leave the Houston office, the Fondren office, and I would make my friend take me to Chick-fil-A and then Krispy Kreme. And I just used the surgery as an excuse to eat bad. You don't get any cravings or anything like that, but I was like, oh, can we go to Chick-fil-A and Krispy Kreme? So if you want to use it, whoever takes you to the surgery to get what you want, definitely do that. And then like the things I wish I knew, she brought up bleeding, but again, 4 times in the last year, and every single time it was the same for me. I barely bled. My biggest advice, things I wish I knew, um, setting an alarm on my phone, because you have to inject yourself within a window, and I would forget, and then it would be like late, and I'm texting or emailing Mary Lou like, hey, I'm late, what's gonna happen, because I just like got watching a show or doing something. So you do need to be really mindful of your time. And then the last thing I wish I would have known is just like how rewarding it was going to be, and just how easy it was. So the first time I went into it like really fearful, and then the second, third, and fourth time it was, like almost mindless. And so I just wish so many women, my main message is like, don't be scared to be an egg donor, because what you're doing for women, and for people to start families in general, is unmatchable. I wish I would have known how rewarding it was, and I wish I could have done it sooner. I was 28. I'm going to be 29 this week, so about a year. I was 28, and I just wish I could have done it sooner. It's so rewarding. And until I started sharing it on my Instagram, I didn't realize how many people actually struggle with this and they need eggs. And you're doing an amazing thing, for what it takes away from you, your time, and maybe the cramps or like the minor things you can get. Nothing compares to you helping give someone a family. And so it's definitely worth it. So, and I'm an open book, y'all. Any questions you have, whatever you want to know, ask me. I will be honest and I will definitely tell you. So just let me know.